Happy Friday, everybody. It's Dr. Bridget Young from babyformulaexpert.com here on a very glamorous Friday. Actually, this is a really glamorous Friday for me. My kids are in bed, so I can be so calm and zen. I did get myself a little Friday cocktail. I'm in a great mood. I had the best day. The boys were hard to get down. God, they are so cute. I can't even handle it. So I'm in a great mood. And today we are going to be talking about how much formula you should be feeding your baby. Welcome. If you don't know who I am, my name is Bridget Young. I'm a doctor of perinatal nutrition and a certified lactation counselor and founder of babyformulaexpert.com. And not really every Friday, every-ish Friday, anywhere between 4 to 10 p.m. Depending on when my children allow me to, I do happy hour on some infant feeding topic. Today we're going to be talking about how much formula you should be feeding your baby. Like, how many ounces should your baby really be eating? This is a really basic question that I actually have never talked about before because I purposefully avoid it all the time. I have my notes here, so I want to make sure I don't forget anything. Oh my God, I wrote down all the reasons I avoid it. These are all the reasons I had not talked about this previously because I don't like talking about it. Because, I say this all the time. Every baby is different. They're their own person. So like if you tell me my baby is exactly 3 months and 4 days old, well, the range in what a 3-day and 4-month-old baby could be eating and be healthy is huge. So every baby is different. So I hate throwing a number out there because the last thing I want to do is panic some parents whose baby is doing fine, but they're not fitting into this mold. And there is no such thing as a perfect mold because every baby is different. The other thing is breastfed babies and formula-fed babies are different. This is not new news to anybody, but they also eat different amounts. That also means that mixed fed babies who are getting both which are the vast majority of babies, are this massive gray box that clinicians don't know what to do with. So it's just best to ignore them. So that's another reason. It's really hard to make recommendations for babies who are getting a mixture of breast milk and formula. And God forbid you're feeding at the boob, then we don't know how much the baby's getting. So we'll just throw our hands up and not talk about it. That's kind of how I approach it. And lastly, just like with breastfeeding, with formula feeding, the number is not the goal. Of course, we want you to engage with responsive feeding with your baby, following your baby's cues, feeding them when they're hungry, stopping when they're full. And sometimes when you're focused on a number, it's really hard to do that, which is why, myself included, people usually avoid talking about the topic. But of course, if you're exclusively formula feeding, you need somewhere to know how much to put in a bottle. And so that's try to give you some rough guidelines today and where I would like you to really be focused on when you're making up your bottles and having, an amorphous goal of how much your baby should be eating. So here's the number. And again, I cannot emphasize enough that this is very loosey-goosey and hardly scientific at all. A very rough number to sort of shoot for exclusively formula-fed babies is 2.5 ounces per pound of body weight with a maximum of 32 ounces of formula in a given day. That's the total day. So if you have a 10-pound baby, 2.5 ounces per pound, that's roughly 25 ounces of formula. Now, the standard deviation on that, meaning like the range, is going to be huge. Some babies are going to drink significantly more. Some babies are going to drink significantly less, and all of those babies could be perfectly healthy. So not only that, but your baby, if they meet that and they're eating right about 25 ounces, it'll go up and down from day to day. Of course, when you see your baby's growth chart, it doesn't just perfectly go up. They kind of go up and flat and up and flat, So they'll eat more when they're rapidly growing. They'll eat less when they're not rapidly growing. They'll eat less when they're sick, and then they may recover after they're feeling better. So again, these are all reasons why it's a really loosey-goosey estimate of just what you should be aiming for on an average to start with until you really figure out what your personal baby is thriving on. And then the maximum of 32 ounces. I know we have to have a maximum somewhere. So if you feed 33 ounces, your baby will be obese and you have failed. I'm obviously joking, but I kind of get that vibe sometimes when I hear people talk about this. No, It's fine. If your baby needs 33 ounces or God forbid 35, the reason we have a maximum is the following. So I'm going to explain to you why we put a maximum on the intake so that you don't panic if someday your baby's growing and they seem like they want an extra 2 ounces. Your baby will not explode. The reason is that we do know, before I get into this, we do know that formula-fed babies have a more challenging time self-regulating than babies who are fed at the breast. There's a lot of reasons for this. Some of it, and a lot of it we don't know. Some of it is differences between breast milk and formula. Probably a lot of it is nursing at the breast takes a lot of energy and can take a longer time. And so babies learn more quickly how to regulate and feel like, oh, I'm full, I'm going to stop, or I'm hungry, I want more. So because of this, we want to be sure that babies who are getting formula from a bottle have the chance to develop good self-regulation. And so because they are a little behind on the curve in that way, they're more likely to be able to be overfed, meaning they're more likely to take a longer time to be like, oh, I am full. So that's one reason that there's a maximum put on it. The other is you definitely can overfeed a baby from a bottle because a bottle takes less energy to drink from. So for example, if your baby's drinking 50 ounces of formula, that's probably too much. And if you overfeed a baby, it can lead to excessive weight gain and put that baby at risk for overweight in their future, which of course we'd like to avoid if possible. The other thing that nobody talks about that I see all the time in my practice is oftentimes if a baby seems like they're really hungry and they're, seeming like they want 40, 45 ounces of formula, I have a hair, sorry guys. It may be the symptom of something else. So maybe they have silent reflux and they seem like they're really hungry because they're gulping down because it's soothing to them to have an incoming volume, which calms their reflux. Maybe they're having some other gastrointestinal or some other discomfort in their life, and the act of suckling calms them. So even though they're not hungry, the suckling, because the act of suckling is calming to babies, gives them some relief. So they seem like they're hungry and they like to eat because it is able to provide them some relief. So it's nice to have some kind of a limit so that you can have a flag like, oh, is your baby eating 45 ounces of formula? Talk to your doctor. Maybe there's something else going on that we can address. So those, am I missing anything else? No. So those are the general reasons why you have a maximum. We don't want to overfeed the baby. We want formula-fed babies to have the best chance possible to establish good self-regulation patterns early in life, like breastfed babies. And we don't want to miss symptoms of something else that could be easily missed by hunger. So so there is a maximum there to just give you a range of what may be normal, what may be not. Now, if you have a big baby who's growing really fast, they're going to need a lot of food. And I am totally guilty of this in the past, saying there is no reason a baby under 6 months should ever have an 8-ounce bottle. Oh my gosh, that's too much. Well, when you think you know everything, you're clearly young and stupid. And I have a nephew, and I call him my gentle giant. This kid he's just really big. He was born big. He's still big. He's not even 2. He's bigger than my 4-year-old. He's perfectly proportioned, but the kid is just growing like a weed, and he took huge bottles, but I tell you, calorically, he needed it. His growth rate was off the charts, and his body needed that many calories to grow. And, I helped feed him. It needed that much, just like a slap in the face, and me like, Bridget, you better keep your mouth shut. You don't know what you're talking about. So we have these rough guidelines so that, again, I feel like if you know the reason behind the guidelines, you'll know. If your baby's normally drinking 25 ounces and then all of a sudden they seem like they need 40, again, that's a sign that maybe you should talk to your doctor. There might be something else going on. Okay, I'm going to end on that one. So here's another thing. So there's 2.5 ounces per pound of body weight. I harped on why that's such a big range. That doesn't apply to breastfed babies. Breastfed babies usually drink a little less. They usually drink less breast milk than formula-fed babies drink of formula. So if you are, for example, an exclusively pumping mom, you know exactly how many ounces of breast milk your baby is drinking, don't panic. They're probably drinking much less than that, and they're probably growing just fine. So ain't no thing, mama. You're doing great. If your baby is mixed fed, God help you. I don't know what to nobody knows what to tell you. If your baby is mixed fed, you can kind of take the 2.5 ounces per pound and round it down a little bit. If you're nursing at the breast and then supplementing with formula, you really, really just need to trust your intuition and trust that your baby knows what they need and they'll communicate to you. So if you're nursing and then you're giving them the top off bottle to be sure they're getting enough, follow their cues. If you normally offer them a 2-ounce bottle, and they suck it down and are actively swallowing air and gulping at it when the bottle is over, they're probably still hungry. Go ahead and offer them another ounce. If they turn their head away or spit up a little bit after half an ounce, they're done, they're full. And you could experience both of those things from one day to the next, depending on how much they're growing. So that is the perfect place for me to try to wrap this up. And so I gave you numbers. If I don't like to give you numbers, the best advice I can give is breastfeeding, formula feeding, mixed feeding. The best thing you can do is follow your baby's cues. I know. It is so easy for me to sit here with my toddlers asleep and be like, just feed your baby when they're hungry and stop when they're full. It's so easy to say and can be so hard to do. But that's our goal, is to feed them when they're hungry and stop when they're full. So do your best to pay attention to how they're communicating to you, and then you have this rough estimate to help you if your little one gives such subtle cues that it's easy to miss. The other thing is you have other indicators, so it doesn't have to be all about the ounces. How many times a day are they wetting a diaper? How many times a day are they stooling, or how often are they stooling? Formula-fed babies may not stool every day, and that's totally fine. Is their output consistent and healthy? Perfect. How is their growth? Are they continuing to grow on their curve? Then you're doing an awesome job. Don't worry about it if they're eating a little less or a little more than that 2.5 ounces per pound. And God forbid if they actually eat 33 ounces in a day. Lordy. The other tiny tips I can give if you're actually, I would say any baby, this is my personal recommendation. I like to recommend going with the slowest flow nipple that your baby will take. This is especially helpful if you are also nursing your baby at the breast, because it is a lot of work to get the milk out of there. And so if they're getting a really fast, easy flow from a bottle, it can make them a little lazy at the breast and make them not want it as much. So it's nice to give them a nice slow flow formula or anything in a bottle so that they stay motivated at the breast. Also, if they're exclusively formula fed, I like to keep them as slow as they'll take until they really show signs of needing and wanting a faster nipple, for the reason we talked about before, that it's easier to for them to be able to process their signaling cues of, oh, my tummy is full, I don't want any more, if it's coming in slower and they're not actively gulping down large volumes. True. I can't even read my own handwriting. Oh, yeah, I can now. And if your baby is a really big feeder, so if your baby is one of those babies, and there definitely are tons of them who seem hungry all the time, if you offer them a 10-ounce bottle, they would drink it. It's really, but some babies are like that. So if you've got, I call them a big eater, then try, you've heard this advice before, try other things. So if it's only 2 hours since they've ate and they normally go 3 and they just had a big bottle, change their diaper. If you're using a pacifier, offer a pacifier. Try to meet their other needs first. And if they're still hungry, feed them. But, try to see if it's something else wrong first to be sure that they're not getting overfed if they would eat no matter what you offered them. So those are my tips. And my very last one, and is most important, is trust your intuition. I can be all high and mighty and sit here and talk about this, but I don't live with your baby. You live with your baby. You know your baby so well. And mommy and daddy intuition is a real thing. So, pay attention to your baby's cues, trust your intuition from there, and then you can have these very, very loose guidelines in the back of your head. But much more important is your baby's cues, your baby's output, their urine and their stool, and your baby's growth. And if those things are in line, then the numbers don't matter. All we care about is a healthy, happy baby. So I really hope that's helpful. I probably gave enough disclaimers. And yeah, it's so hard. It can be so hard to know how much and how often to feed your baby because every baby is different. So again, I really hope that was helpful. You're welcome to leave. I got a couple comments that I will try to answer. Oh, Natalie says my skin looks so good. You know what? My skin does look so good, but it's the webcam. I turned it on. I was like, God, girl, I wish I could like put this filter on all the time. I'm not looking this great in real life, Nat. You're going to see me soon, but I so appreciate the compliment. Oh, okay. Look at it. People are saying nice things. Okay. Do I have all these? I don't know if I have any actual baby questions. So if you're watching this and you have an actual baby or nutrition question, put it in the comments. Give me 48 hours to get back to it because that's how much I need. And I hope this was helpful. My biggest hope is that above all, that this is calming to you and encouraging to you that you know how to take care of your own baby. And it's nice to have numbers, but numbers are not the most important thing. If there's something I can do to help you, if your baby is having formula tolerance issues, come over to babyformulaexpert.com. I have a lot of information there, and you can also find information about how to work with me privately if I could be a service to your family, which is my greatest joy. So have a wonderful week. I don't know if I'll see you guys next week, so I won't promise that, but I will see you soon. And again, if you have a question, leave it in the comments and I will get to it eventually. Okay, have a great night, everybody. Bye.